We can speak now to Dr. Jigna Modha, a consultant anaesthetist at University College London. Dr. Modha, thank you so much for joining us. When a COVID-19 patient comes into intensive care, talk us through what you would do as an anaesthetist.
Different patients come in with different symptoms. What people know about mainly is, they need a ventilator and their lungs need support with their breathing, so they're induced into a coma. But many people come onto intensive care with COVID who need support with their breathing, but they are conscious. So it's a special mask that's put on their face. And that just helps them with their work of breathing when they're especially tiring, because COVID-19 causes such a severe viral pneumonia, as you know.
You may not wish to talk about the Prime Minister's case, given that you are not his physician, but from what you've seen, the reports of you've seen, how typical has the progression of the illness been in him?
I wish Boris Johnson the absolute best. I can only speak from my experience and what I've heard, in terms of what's going on in the news. It's all speculative at the moment, as far as I'm aware. But patients admitted to intensive care, as I said, they require oxygen. Sometimes they require a bit more support with a special face mask, or they require a full-blown coma with a ventilator, a breathing machine to help them with their breathing. And we don't know, or I don't know specifically, not being his physician, looking after him, what it is that he is requiring right now. I think, as far as I'm aware, it's just a precautionary measure at the moment.
You can be in intensive care even as a precaution, that's right?
Yes, well, if there are certain patients that, aren't particularly suitable for the ward because they might need more nursing care than the ward may provide. And sometimes we do admit patients to intensive care for more closer observation, so that if they did deteriorate, the right people are around, to act swiftly to support these patients. And in my experience, when patients do deteriorate with COVID, they can deteriorate quite rapidly. So being in that right environment is the best thing, and is what would happen to anybody who may need it.
I imagine you're learning about the virus every day and every week as this goes by. What are some of the things that you still really need to know in order to help you treat patients?
It's a new virus. It's been around since the beginning of the year. We're still learning about how it's behaving. From my experience working at UCLH Hospital in London, we can see that it affects any age group. Previously we were quite naive in thinking it just affected the elderly, but it can affect any age group. And you might be fit and well or have multiple medical problems. We're learning as we go along. I think the next few weeks will be quite important in terms of the virus revealing itself to us, in terms of what we can do for it. But the treatment is supportive. We can support you with oxygen, with fluids. We saw today on the news a special clip from my hospital showing how we put patients on their front if they are on breathing machines. And we're just learning as we go along.
Dr. Jigna Modha, thank you so much for joining us.